Hello all. In recent videos, we have been discussing batch flower remedies. A common question arises, are batch flower remedies and homeopathy are the same or are they different? In this video, we will clearly understand their differences in a simple and practical way. Batch flower remedies were developed by Dr. Edward Bach. Homeopathy was founded by Dr. Samuel Hahnemann. Both are gentle systems of healing, but they are based on different principles and approaches. The main difference lies in how remedies are selected. Batch flower remedies are chosen primarily based on emotional states such as fear, anxiety, or sadness. In homeopathy, we consider the totality of symptoms, which includes mental, physical, and general characteristics of the patient. So, the approach in homeopathy is more comprehensive. Also, in cases of fear, anxiety, sadness, if the diagnosis is more serious or leads to some chronic ailment, we should not keep on trying to relieve the patient with batch flower medicines. Batch remedies mainly help in balancing the emotional disturbances. Homeopathic remedies act at a deeper level, not only on the mind but also on physical complaints and functional disturbances in the body. In batch flower therapy, remedies are often selected based on the common emotional patterns. In homeopathy, treatment is individualized. Even if two patients have the same disease, the remedy may differ depending on their unique symptom picture. Batch flower remedies are mainly used in mild emotional imbalances. Homeopathy is used in a wide range of conditions, including acute diseases as well as long standing chronic conditions. In practice, the choice depends on the case. If the emotional state is the main concern, batch flower remedies can be helpful. But when a complete symptom picture is available, including physical and general symptoms, homeopathy becomes the preferred approach. So, the decision is always case based. In this channel, we will continue discussing both batch flower remedies and homeopathy. Going forward, there will be more focus on classical homeopathy, including Materia Medica, Repertory, and clinical understanding. Thank you.